First of all, would I like to thank you, Kim, for the invitation to present some of the results of my PhD. You see, 4 years' work in 30 minutes is a challenge. The Sonas Programme have been used in Ireland for about 30 years, and we have heard people sharing how positive the program is for the residents. Even though the stories are valuable, the question still remains, can we prove that it helps? For this we need research. The main aim of my PhD, which I started in 2014, was to measure the effect of the Sonas Programme. I have to remember that now. Before I present the main findings from my study, would I like to give you a short background about the sensory stimulation and the importance of communication. Communication difficulties among people with dementia is a well-known problem and is one of the first symptoms of Alzheimer's disease. As the disease progresses, the ability to communicate is reduced, primary verbal communication. And I'm sure that most of you have experienced that. In order to compensate for the lack of verbal communication, persons with dementia often use non-verbal communication and behavior sometimes to communicate, which helps them to remain a part of our life. However, the expressions might turn into agitation and aggression, and the frequencies of these symptoms increase when the severity of dementia and this impairment can enhance the risk of misunderstanding and misinterpretation. Indeed, so severe are the effects of dementia sometimes on social participation that it has been termed a social death. At the same time, it is important to remember that the sense of belonging and the wish to maintain social contact is a basic human need and does not change with dementia. So why the use of psychosocial interventions? We talked about that this morning, actually, the importance that is the only way. We don't have a treatment yet. So far, there is no cure for dementia, and therefore psychosocial interventions are recommended to help the person living with dementia to cope with challenging behaviors and to improve their quality of life. Research projects to date emphasize that psychosocial intervention should be the first choice before medication, and there are several reasons for this. Challenging behavior addresses a wide range of underlying problems, and then the question is, do we ask why the person is restless or seem aggressive? The person might have hearing problems, sleeping difficulties, communication problems, or feel lonely, but is not able to express this to us. There are also concerns about the side effects of the use of antipsychotics in dementia. The persons might become sleepy or unsteady. Antipsychotics might also mask the actual need they have. A patient might be restless or agitated because of pain, but are not able to express this. There are several examples that people with dementia who wander up and down the corridor without knowing what is wrong. And then sometimes it we use to maybe calm them down instead of trying to find out why they are wandering. So what is sensory stimulation? There are many different psychosocial methods, and one form is sensory stimulation, one of many. It is often referred to as different techniques used to stimulate the senses to increase alertness and reduce agitation as well as to enhance quality of life. It has been difficult to find a suitable different definition. I've really been searching of sensory stimulation, but Alzheimer's have one, saying uses everyday objects to arouse one or more of the 5 senses with the goal of evoking positive feelings. And it's important to notice that the focus is to evoke positive feelings, not to calm down. So why is this important? The life in an institution becomes easily boring and passive, even though it has improved a lot the last years. And as the memory is getting worse and daily activities become difficult to carry out, the need for stimulation increases. However, even though the need for stimulation increases as the dementia progresses, there has to be a balance. too much noise can trigger challenging behavior like agitation, and lack of stimulation might lead to restlessness. We also know that human abilities and functions will lie dormant unless they are stimulated and must be exercised to be retained. Sensory stimulation, like music, can awaken latent memories and abilities. I think all of us have had that experience, that a song can recall memories, or a smell of a Christmas pudding here in Ireland can remind us of Christmas. We know that the 5 senses change during life. It is, as I now, I can't see the same as I did when I was young. It is part of normal aging, but it is not documented any further deterioration of senses in people with dementia. It's the same. But what we do know is that how people with dementia interpret what they see, the interpretation is changed. The person will therefore be able to maybe to smell the flower, but not necessarily tell us what they smell. Improvement in the ability to communicate can help the person to express their basic human needs as well, prevent isolation, and strengthen the person's identity. The Sonas Programme is a multi-sensory stimulation program which involves cognitive, sensory, and social stimulation, including all the 5 senses: touch, smell, taste, hearing, and sight. Sonas is a word in Irish that means well-being, joy, and contentment, I have been told. The program was developed as systematic thread goal in 1990 as a therapeutic activity for people who have significant communication impairment, primarily as a result of dementia. And is used, as I have heard, about 200-300 nursing homes in Ireland today. Focuses on stimulating the senses in the belief that the senses are the gateway to communication. The aim of the Sonas program is to activate whatever potential for communication has been retained by an older person with communication impairment, also to see what is still there, to encourage the creation of an environment which will facilitate communication, and to activate the potential for communication recognized and accepted as an essential part of care planning for older people. But why is communication important? First of all, it is important to remember that the need for belonging and companionship is considered as a basic human need, as I already said. It is even said that only one more basic human needs than communication is survival. It's quite strong. And Kitwood, which we heard about yesterday, which is known for his person-centered approach, suggested that the person's experience of well-being or quality of life could be improved by improving the communication. This is because communication gives an experience of belonging, a connectedness. A little bit about the Sonas session. The aim, as I said, is to improve communication or contact. The program is delivered at least twice a week in groups of 8 residents and follows the same structure each time. That's the whole idea, repetition. Repetition that because we think that will help the people to that individual approach, that repetition I remember from time to time, and we know that people with dementia can still learn. Each session takes 45 minutes. It is recorded beforehand, so you don't have to really remember everything either. And it's led by a person who is trained how to perform the Sonas program. It's a 3 days training. And the program consists of these 14 points. It's a singing, also a welcome song at the beginning, where each person are wished welcome into the group by their name. There's also some exercises to music, smell, taste a little bit, where we never ask what is it, but we present the taste and the smell and so on. And there is some songs, and then they're listening to a proverb and have a sing-along. I won't have time to go into all the details, but it's the same structure every time. Before I started the study, I searched for previous studies on the Sonas program. I found 9 studies. However, the variation in sample size, the length of the intervention period and number of sessions, as well as methodological weaknesses, made it difficult to compare the results and draw any conclusion. So with only few published studies investigating the effect of the Sonas program, I saw the need for more studies to overcome some of the above-mentioned limitations. The 5 published studies, all done in Ireland, documented positive outcomes on the well-being, mood, and cognition for those who attended the Sonas program, whereas the largest study who used communication as outcome reported no significant changes in communication. But as I said, this was a very small sample size over a very short period of time. So based on these findings, I decided to measure the effect of the Sonas program on communication in people with dementia. Most psychosocial methods stimulates only one of the senses, like music. So the Sonas in that way is unique by stimulating all the 5 senses. That's their combination. The method, we talked about trials yesterday. We decided to use an RCT, randomized controlled trial. And you might remember that we talked about the importance of having both kind of research. We need to talk with people, to interview people about their life, their experience, but we also need to measure the effect. So what we did, we had included 120 people with dementia with an MMS score between 0 and 20. And the trial went over a period of 6 months. Little about the setting. It was a long process, complicated process, which took time. We knew we needed 80 participants to have a certain power. And the beginning, I went through the HICVA reports. There are 600 of them. But I started with nursing homes in and around Dublin to kind of have a kind of an area. I found 168 nursing homes in these counties. And as many as 78 nursing homes were already using the Sonas program, so they were excluded. And 65 have never used it, they were not using it at the moment. And that the second inclusion criteria was that they needed at least 40 residents in the nursing home, because we needed 2 groups, so it has to be a certain number. So this left us with 25 potential nursing homes. However, after 3 rounds, sending out emails again and again, only 6 accepted to participate. So there were 3 from County Dublin, 2 from County Laois, 2 from County Louth, and 1 from County Louth, and 1 from Meath. That was the inclusion. The Sonas group were carried out twice a week over a period of 6 months, and they really followed the plan very well. It was led by a Sonas licensed practitioner and assistant. There were 8 people in each group. They kept it 45 minutes, but they have a record on all that, how they did it. However, it is also important to remember that these residents continue to participate in different activities also. So it sometimes can be how do we know what works really? So what we did, we also included a reading group who were listening to a carer who read from a newspaper for 45 minutes twice a week. Also the same amount, the same length. And all residents, they also attended the other activities in the nursing homes. So why did we include a reading group, also the third leg, kind of? The intention was to rule out the possibility that an effect, if we had an effect, of the Sonas program was caused by a special attention given to the participants, but just by being in the group, rather than the actual content of the intervention. And the last group, or last leg, was then the control group, who just continued the ordinary activities. As I said, they attended almost 40 sessions during 6 months. They did very well, as an average. And out of these 120 participants, 105 completed the study. Few died, somewhere, I think 11 died, not one in the Sonas group. I don't say the Sonas group prevent deaths, but it was interesting that none of the participants in the Sonas group died. 9 of the 11 who died were in the control group. It doesn't say, so I can't use that for anything, but it's interesting. The effect. I hope it's not too complicated, because this is kind of loss of statistics, but I'm trying to do it simple. Even though we didn't find an overall effect of the Sonas program, we found that the Sonas group did improve significantly in their communication ability. We could measure, they became better. They had less communication problems during the 6 months. Whereas this was almost unchanged in the reading group, and it decreased in the control group. So we saw, you can see the lines here, there was a change. It was a clear. But statistically, that's a different thing. So the findings indicate that attending the Sonas session could improve communication ability more than attending a reading group or being in a control group. We know that. These findings are interesting because we know that people with moderate to severe dementia usually have a decline in their cognitive function over a period of 6 months, but this improved. That's interesting. Therefore, we would not expect their communication ability to improve, but get worse, which it didn't. It improved. But how is this possible? So what we also did then was to look at aspects of communication. In this form, there's 14 different aspects. And when inspecting these aspects of communication, an overall effect was demonstrated in the interest in past events, humor, and having general knowledge. It showed a difference in the Sonas group. And also pleasure. Also they expressed more, had more joy in life. The pleasure was better than at the beginning. The same was seen in relation to the attempts at communication. Also they tried to communicate with the people around, much more than earlier, which in itself is positive, but trying to be part of the world. So what we did, the last question we asked was, if the Sonas program is suitable for people with severe dementia, more for them than with moderate. Is there a difference? Because people with moderate dementia don't have the same communication challenges. So we can't expect so much changes. So we divided the group in 2, with moderate in one and severe dementia in the other one. What we saw was that the Sonas group then, those with severe dementia, they had a significant improvement in communication. But then I've got something. But it ceased after 3 months. It kind of became the same. It didn't continue to become better. So this ceased effect after 3 months for residents with severe dementia could be due to progression in dementia, could be one reason, or even that the participants have become bored by attending the same program twice a week. And that's why we came up with the idea, or kind of to remind ourselves how important of changing maybe some of the songs after 3 months. The structure can be kept, but some of the content, like poems, songs, it seems to be, as I think it's a good idea to change it after 3 months. 6 months or 12 months is too long. Can be one reason. And inspecting the 3 groups separately, it was only the Sonas group who improved, those with severe dementia. So the conclusion we came to was that those who participated in the Sonas group program showed a significant improvement in their ability to communicate. Secondly, that the Sonas program affected some aspects of communication more than others, mainly for those who do not require verbal communication skills, like showing to express pleasure. And the Sonas program has a significant effect on communication of people with severe dementia. That we know. So let us remember that even though speech becomes difficult along the process, people have to rely on others for their care. They retain a wide repertoire of non-verbal communication as well. And I think the Sonas program is a way to kind of retain, also keep that. Keep the non-verbal communication, even though when they come to a certain stage where you don't understand the words anymore either. But non-verbal communication will be there, and to use that more. There could be several reasons behind such an intervention effect more than that. First, this extra multisensory stimulation during the Sonas session might have greater impact on the communication ability than listening to the news. So that multisensory might be one reason, or maybe the extra attention. We don't know. The almost unchanged communication ability reported in the reading group might be explained that the fact that some stimulation is better than none, maybe. It's better than nothing. They have something extra. And this supported by the decrease in communication ability reported in the control group who didn't get anything extra. They become worse. So at least those with the reading group, they had something. After I had collected too many data during the PhD, I couldn't use everything in the thesis, but we had data on anxiety and depression as well. So after the PhD period, we did a separate study on that. And we found no significant reduction in anxiety from baseline to follow-up in any of the groups. They didn't change about anxiety. One reason for the lack of effect on anxiety could be that the study was underpowered, as the average baseline anxiety sum score on the participants was over 10, indicating limited potential for further reduction in anxiety. So we had kind of the wrong, they didn't have problems enough easily. If they really had problems with felt loss of anxiety, then we could have expected maybe a change, but they didn't. But the participants who attended the Sonas group showed a significant reduction in depression from baseline to 12 weeks follow-up. And even though we found no overall differences in the trend depressive symptoms between the groups, the participants in the Sonas group experienced a significant reduction in depression. And we don't know why. I mean, I think as my supervisor said, that anxiety is stronger later. Also, depression is kind of more present at the beginning of the dementia journey because you're more aware of what's going on. And a time comes that you don't have the depression anymore, but the anxiety comes. It's something going on, I don't know what it is. So this, we need, also, if we want to follow this up, I think we have to do a bigger study on anxiety and depression. This doesn't show enough, really. Not with the data I have. Then we are going to Norway. In June 2021, Diakonhjemmet in Oslo, where I work, got permission from Engaging Dementia to translate the program into Norwegian and established a training course for healthcare personnel in Norway. Diakonhjemmet is a private non-profit foundation within the Lutheran Church of Norway and was established in 1890. Today, Diakonhjemmet offers health, care and education services in close cooperation with the public sector. So we have hospitals, a college, different nursing and social work and everything. And then we have where we have 4 nursing homes. We run 4 nursing homes. We have home care for about 1,000 people, assisted living facilities, and kindergarten, 2 kindergartens. As soon as we got the permission to translate the program into Norwegian, we established a group consisting of a singer, pianist, and a technician, and myself. Since the songs had to be adjusted, and we couldn't use the Irish songs, we had to need other songs, to our residents, one of our activity coordinators collected different songs known to older people in Norway and piloted them in one of the nursing homes on people with dementia to see how was the response. We also worked closely with Sister Mary, who assessed the rhythm and tone, etc. She went through everything to make sure that was the right type of music. And we found 12 suitable songs for the sessions, enough to make a second version later. We need 6 in each. So in October 2021, the translation was ready, and we could offer the first training program for 16 of our staff from 3 of our nursing homes. The 30th of November 2021 was the first certification of Sonas licensed practitioners in Norway. And we're very happy to welcome Sister Mary and Kim from Engaging Dementia to be present when the first 16 Sonas licensed practitioners received their certificates. It's a big celebration. And since then have we certified another 18 in Oslo and 16 in North Norway. Now we are working on how to make the program more known in whole Norway, and our aim is that all nursing homes in Norway will use the Sonas program. A special thank you to Engaging Dementia and to you, Kim, but also to you, Sister Mary, I know you are looking at us, watching, for bringing me into the world of the Sonas program. Thank you so much.